Welcome, everybody. It's Earl Stephenson Jr., your Atlanta board certified plastic surgeon, and happy Saturday. It's August 10th. I can't believe it. Summer is almost over. We're pushing up on Labor Day. I really cannot believe that. And it's really going to be a great fall coming up. I've got some things brewing myself. I need to take a little vacation myself before the fall kicks in to full effect because that's when we really get busy here in my practice. But nonetheless, I'm here today. This is Plastic Surgery TNA. That's talking advice for those of you who are new to the channel. And if you are, I welcome you. Thank you for joining. Or those who are returning, of course, thank you, thank you, thank you. If you would do me a favor, if you would just comment, like, subscribe, that will help the channel because what I'm about is pushing truth and transformation. So this will allow me to push the truths about plastic surgery, to educate you about plastic surgery. Everyone talks about plastic surgery, good, bad, or indifferent. So it is a hot topic all the time. And if you are interested or there's something that's tickled your fancy, you want to make sure that you are well educated so that if you proceed, that things can be done to your liking to get the outcome you desire, but safely. And that's the most important part. So, on that note, what I want to do today, today's title of the podcast, and we are live. I've tricked you today. Usually I'm taped, and I've been taped for the last month, but I am live today. I'm not like SpongeBob from Encino, California, but we are live here in Dunwoody, Georgia. So if you have questions, comments, I would encourage you to join on, ask your questions. You're getting a free consult. I'm here. I'm here for the next 30 minutes to 45 minutes, depending on the volume and what we can get covered. So, this is your chance to have a free consult. Ask a question. I will answer it to the best of my ability. So, if we don't get to your question, leave it in the comments below, and I will, after this episode, answer all questions. Certainly, you can reach out to me if you want to do a little deeper dive. You can call my office at 770-466-4700. We can sit down and we can schedule your personal conversation. I take my time. I make sure that we answer all your questions and make sure that you are armed with the information so that you can make the best decision for you. So, with that being said, let me really get down to the episode. Uh, we are going to talk about botched and beauty, or botched or beauty. People are afraid of surgery, of course. People are afraid of plastic surgery naturally because it's a surgery of choice. It's not like you're going to have a heart operation or you had an intestinal operation. These are things of necessity. This is a procedure of choice. So people want to make sure that things go right, but it is surgery. And I want to really make sure that people understand that, yes, it is surgery that you choose and not surgery that's necessary like a heart surgery, but it's still major surgery. And so things can go wrong. Can go wrong in the best scenario. And you want to make sure that you have a plastic surgeon, such as myself, who cares about how things go. And if they go a little bit sideways, who tries to get them back in the middle of the road and does everything that he or she can to do so. But sometimes you just don't have folks like that. You don't have plastic surgeons like that. You have derelicts and nerdy whales, and they just do whatever for the dollar. So you got to make sure that you avoid these folks. So what I want to do is talk about a few body areas and a few operations. We're going to talk about some botched procedures on the face. We're going to talk about botched procedures on the tummy and botched procedures on the booty. It's hard for me to show botched procedures on the breast because of social media and the nipple and all that stuff. They try to ban you and to Alaska and take you down and eliminate your channel. So I'm not trying to do all that. So unfortunately, I can't show you or talk about botch surgery of the breast, but we'll hit on face and specifically facelift. We'll hit on tummy. We'll talk about tummy tuck. We'll talk about liposuction, and then we'll follow that with BBL. and then I'm going to show you a case. And I always show this case because it's a really remarkable case because the story is phenomenal, and you probably have seen it before because it really drives home all the principles, not about bot surgery, yes, about bot surgery for sure, but about how someone who is well trained, who's board certified by the American Board of Plastic Surgery, can help you out of a perilous situation. So let's sit back. Remember, if you have questions, I am live today. Pop on. I love questions. If we don't get to those questions, leave those questions in the comment. So here we go. All right. So the first thing I'm going to pull up, and the first thing we're going to talk about facelift. And I scoured the internet. So these are not my patients. These are not patients that have been sent to me, even though I do revision surgery. But this is something that I pulled from the internet. And the last set of pictures are actually my pictures. So we'll get to that. So here we go. So the first one is about facelift. And in a facelift surgery, people are so afraid of that. They're so afraid that they'll have an unnatural look, of course, because it's your face. You can't hide it. If you have a breast surgery and something's not quite right, a tummy surgery, something's not quite right, even a butt surgery, something's not quite right, you can kind of hide that with clothing. You cannot hide your face. You cannot hide a facelift botched procedure or unfortunate procedure. You can't hide a bad procedure from your eyelids or your nose. But we're going to stick with facelift only today. We'll get to those other things in another time. So, the telltale sign of a poorly executed facelift is that you have this kind of tightening, like somebody's been in a wind tunnel. And that is for sure a telltale sign that you had a novice as a surgeon. Let's just cut it to the chase. He or she had no idea what they're doing. And that's called a wind sweep. And you can kind of see that here. It's just an illustration. You see how the skin wrinkles, and we all have natural lines of relaxed tension. That's the fancy word that we learned, that are natural lines and flows of the face and body that show us kind of the contours. It helps us sometimes plan incisions along those natural lines. In a face naturally does not have lines that sweep up. That is a telltale sign that you had a novice as a surgeon. So you need, as best as you can on the front end, to have an ounce of prevention, because it's going to be worth a pound of cure in most of these cases, and especially for this. You need to try to drill down on your plastic surgeon as to his or her expertise with facial surgery and facelift specifically, if that's what you're interested in, so that you can look at outcomes, understand their thought processes, how they handle situations, how they handle difficult situations, and how they're going to guide you from before to after, where you're enjoying all the results of a fabulous facelift, not a facelift that's less than ideal. So in this case, in a facelift, obviously, as you would think, an incision is made by the ear and the skin is lifted up, and then the extra skin is kind of pulled in a direction to remove the excess to tighten the skin along with the muscle as well. But we're going to focus on the skin here because this is where this is noticed. The skin is then not just pulled in the same direction for every patient. It's not pulled straight back, it's not pulled straight up. It's pulled in the line that is natural and relaxed for the patient. So in this case, for this lady, her skin was pulled straight up, and it gives this sweeping, contour of her natural relaxed lines in an unnatural fashion. She probably should have had that pulled maybe straight forward toward the ear, or maybe even straightly or slightly downward angled, but that would have given her a more natural appearance. So what do you do about this once it's happened? Well, it's really kind of tough to, correct the sweep. There are not many plastic surgeons, and myself included, that would really entertain lifting up the skin and kind of redraping it. It can be done, and it's probably a reasonable thing, but it's just a lot of surgery. What we probably would try to do is try to resurface the skin and resurface those unnatural lines. And a couple of ways to do that. obviously we'll start with a just a basic regimen and making sure that you have good skin health. That's make sure that you've been wearing sunscreen, make sure that you are using uh, retin-A to promote skin health. And then we would try to resurface, or I would try to resurface. Let me put it this way, because you want my opinion. I would try to resurface your skin either with a chemical peel, which is what we use in the office most often, or you can have some type of laser surgery that kind of dampen down these unnatural lines or wrinkles. So that is the way I would approach that. And once we've gotten those wrinkles kind of dampened down, and it may take more than one treatment, then I would have you continue with lifelong treatment of your skin with retin A, moisturizer, and sunscreen. But again, an ounce of prevention is worth a pound of cure here. You need to make sure that your plastic surgeon is really, really experienced with facial surgery, aesthetic, and heck, reconstructive as well, because they've been through the gamut. They've dealt with all types of problems and know how to identify them and know how to avoid them, which is the most important thing. So this is kind of a win sweep. We don't want to have this. It's difficult to correct. There are some treatments that can improve this, but the best treatment is to not have it happen at all. So that's the first thing we want to talk about. So we want to avoid that. The next thing I want to talk about in facelifts is about the hairline. We want to preserve the hairline. I don't have hair, but if you can imagine, we want to preserve the hairline and sideburn. We want to preserve the hairline in the back. In traditional incisions for the facelift, and I'm just going to turn and use my own face. We hug the ear, sometimes just in front, sometimes we hug it and we can go in that little nubbin, as we'll call it for purposes of the day. It will go up, and then traditionally now, or more modern, we would go in front of the hairline, in front of the sideburn. So when we pull skin, it doesn't change the sideburn. Way back in the day, if I can say that, we would use that incision, but we would go straight up into the hairline and not in front of it. And so that we would then, when we try to remove the excess skin, we would move not only the skin here, but we would move the sideburn hair back, and it would make it look weird, just like this. We do not want that. I mean, novice is doesn't even begin to explain this. This is someone who's just not trained. It's just not trained in facelift surgery or aesthetic surgery at all. There are a couple of things I want to point out. One, obviously, the hairline is jacked up. It's too far back. There's a really nice distance that we should try to keep on average of about 5 to 6 centimeters. 5 to 6 centimeters. And I'm sitting here at my desk. I don't know if I have a little ruler that I can pull that out, but I don't. But 5 to 6 centimeters is about that wide. I'm just estimating. And anything wider than that looks weird, for lack of a better term. That is the term of the month and of the end of the year. Weird. So we'll use that. So it looks weird. And so we don't want to do that. How do you avoid that? Well, again, an ounce of prevention is worth a pound of cure. I'm going to use that and beat that to death today. But you just try to understand how your plastic surgeon that you're vetting performs his or her procedures, and you look at their results and you talk to them and talk about their experience. And what we don't want to do, and this is your take home message as the client or the patient, you don't want incisions into the hairline. You don't want incisions back here into the hairline. You want incisions that are going to hug the ear, of course, front and back. And then when it gets to the hairline, you want an incision that comes in front of the hairline, and you want an incision in the back that goes down the hairline. So if you don't remember anything about facelift incisions, you want to make sure that the incision always hugs the hairline and it's never in the hair at all. That's for a facelift, and that's how we can avoid that. So that's the first thing. The second thing I'm just noticing, really, they got this purple line, but if you look at what we call this little nubbin, which is professionally or medically called the tragus, it has a really unique anatomy. and it's really, really sculpted. It has thin skin there to give it a three-dimensional look. If you look at her tragus, I mean her tragus, then you see that it's really blunted. It's really kind of doesn't have a great shape. So again, execution of an incision that involves the backside of this to kind of hide the scar so it's not in front really requires expertise and experience to place that incision appropriately, move the skin as you redrape or repurpose the skin and move it so that that skin that now is on this area is very thin and much like the natural skin that was there prior to the facelift. So again, this is just experience for your plastic surgeon, and you want to make sure that you understand and have these discussions. If they're going to use this type of incision, then how do you preserve this so it looks natural so that it doesn't give away the fact that you have a facelift, because you don't want to give that away as you go to your holiday parties this year. You want to look stunning, but you don't want to look fake, and you don't want people to know what happened. And this is a telltale sign, and of course this hairline is just disastrous. So how would I fix this? So how I would fix the hairline is that you would have to have hair transplants. You have to reestablish the border of the hairline and sideburn, and then use hair transplants, which are taken usually from the back of your head and then placed into sites that will map out and grow in a pattern that revisits, reconstructs, repurposes your hairline. So again, we don't really want to do that. You spend a lot of money, time, effort, discomfort with a facelift. The last thing you want to do is have another operation to fix something that could have been really avoided. This blunting of this little anatomic area here uh, is hard to fix. What can I say? There's maybe not too much that you can do about that. So don't have any good solutions. We really have to think out of the box if that really bothers you, or we may accept that that is something that we just can't do, but we would try to make things better by reconstituting the hairline, which will take attention away from this area. Not too many people will notice that, but trained professionals such as myself or the plastic surgeons wouldn't recognize that. The last thing I would notice, and I just popped in my head as I'm kind of looking at this picture, is about her earlobe. And we're going to talk about that earlobe. It's not natural. And I've got another picture to really probably better illustrate that. So let's just jump right to that. Take that down. So this, I think, exaggerates it, but still better shows this. Obviously, this lady has hideous scars. The face, it's really hard to get a bad incision on the face, especially when you, as the plastic surgeon, planned it. It's different when it was a cut from an injury and it just happened where it happened. But you planned this incision. It's so difficult, and you either have to be so bad, or there was a complication that was so hideous that it shouldn't heal like this. It just shouldn't. So nonetheless, this lady has what we call affectionately a pixie ear, like a fairy. The earlobe is naturally attached. Now, I'll show you my earlobe. I've not had a facelift, but my earlobe has never been naturally detached. It's always been attached. That's just me. But the earlobe should have a little freedom of play from the facial skin. As you can see here, her earlobe is plastered down to her face, and it's elongated. It has no shape. That is that is a rookie move at best. For sure. You've got to understand the nuances of a facelift. A facelift is a demanding, elegant procedure, and it requires great attention to detail. Not everybody has great attention to detail. Not every plastic surgeon has great attention to detail to operate on the face. They may be great at body work, and that's where they land, and that's their safe place. And that's all good. But some, plastic surgeons who are going to work on the face must have supreme attention to detail. And this is just a lack of attention and just a rookie move. You can see that this ear's plastered down to this terrible scar and it looks completely unnatural. So, is this correctable? First answer is the answer is yes, it is correctable. Thank goodness. You can have another procedure, whether that's under local anesthetic, whether that's under local anesthetic with IV sedation or twilight, or you can have full general anesthetic and go to sleep. And what I would do is I would remove that scar first and foremost, make that better, release the earlobe, and then reconstruct the earlobe by advancing a little, pulling up a little skin underneath there and freeing the earlobe and sewing it so that it's free and has better contour. So it is possible to be fixed, and that's how I would fix it. But again, we want to avoid this at all costs if we can. So again, that's called a pixie ear. Lastly, we're going to jump to scars. These pictures are really building on one another. We're going to talk about scars, and this is a good one to talk about. But again, I got a better illustration, I believe. So this is a hideous scar. All right, just hideous. And I'm going to present maybe two reasons why. This could be just poor technique and lack of attention to detail, for sure. This could be genetics. This could be the way the patient heals, no matter what was done, how it was done, how meticulous it was done. But the prevention occurs at that point is asking the patient, especially patients of color, if they have a history of poor scarring and specifically keloiding. So if that is the case, then you're it's kind of over. You really just can't have it because yes, you may have a better contour to your face, but you have hideous scars, and what's the point? So this is cosmetic or aesthetic surgery, and everything has to be aesthetic. The incisions, the healed scars, or the healed incision lines have to be aesthetic as well as the contour. So this is not going to fly. The other scenario, I would say that it could be poorly executed in the sense that the skin was pulled way too tight. I mean, just way too tight. When I perform a facelift, we get underneath the skin, we loosen the areas that need to be loosened. I use the muscles, either using a technique where I go underneath the muscles and pull the whole muscle sheet up because the muscles will get laxed and give you jawing and give you kind of nasal labial folds and help that. So I pull that muscular sheet back and the skin kind of comes with it and it just lays as extra skin on your ear. It's just laying there. And all I have to do is just remove it. And it's just really laying there very easily. I never have to pull it to get it to this point. If I did, then that and stitched it together, that area would have so much stress on it, so much tension. As it heals, it would widen and give you a scar like this. So again, you just don't want to you just don't want to have this happen. You just don't want to have it happen. That's all I can say. And the skill of your plastic surgeon is going to be uh, what is going to be it's going to be what's going to determine the outcome here for sure. But you want to make sure again, as the client, as the patient, you try to ask these hard questions and making sure that you are safe. Even if the plastic surgeon doesn't bring this up, you know, I as the client, I have a history of keloiding. Is this going to be safe for me? You push the envelope. So again, we want to make sure that you stay safe. I'm gonna take a drink. Not a drink, but a drink of water. All right. So, nonetheless, how do you fix this? Well, you can do a couple of things. You can do some non-surgical things. You can inject this keloid with steroids, which will soften the area and try to flatten it. You don't want to inject steroids too much because steroids can have an opposite effect. It can really thin that area and make it paper thin, which is then again not very aesthetic as well. You can use silicone gels and silicone bandages. It's a tough area to use a bandage, but silicone gels to put pressure on that and soften the characteristics of that scar. You can use we use small amounts of dilute chemotherapy drug occasionally to kind of break down the scar tissue that forms this thick scar, and it's called 5FU. Yeah, all right, don't go there, but it's 5 fluoral uracil. And so it's commonly called 5FU. And that's funny. But anyway, we use that to help soften it. Sometimes those things don't work, and you have to kind of go back to the drawing board. You have to remove the scar in its entirety, hopefully get underneath the skin and release the skin so that it's a little bit more relaxed and it can lay next to where it needs to be stitched so it's not under tension, and then stitch it up or sew it up and then use steroids and silicone bandages or gels or maybe even 5FU down the road and monitor this incision very closely. So it can be fixed. So that's facelift. We've touched on a couple of things, and we want to try to avoid that at all costs. Let's jump to body, and we're going to jump to liposuction. Just couple of pictures here, because liposuction is a really popular procedure. People talk about it all the time. I got this little muffin. I got these love handles. I just hate my contour. I want a better waist. I'm really not digging, a tummy tuck. Even if I think I'm a candidate, I want to just try to help my contour. So people turn to liposuction. And liposuction, as fancy as all the things that we hear about liposuction, can be as far as what can happen. We get tickle liposuction, we got strawberry liposuction, we've got laser liposuction, we got all these things. It's really just liposuction. We inject fluid typically underneath the skin that has novocaine or lidocaine for pain control, and we inject adrenaline or epinephrine to help reduce blood loss. And then, as technology and medicine advances, we have added other modalities or technologies like ultrasound to help break up scar and help tighten skin. We've added laser to help tighten collagen and skin. It's a heat related contraction of the skin, and in the wrong hands or in the wrong application or used at the wrong time, it can produce bad results. And so liposuction should be a nice, smooth contouring procedure. It's not a weight loss procedure, it's a contouring procedure. So let's bring up the first picture. So this is just illustrating exactly what I just talked about. This, although her silhouette, the the borders of her body are sculpted, her abdomen, the front of her abdomen looks hideous. I mean, it's just hideous. It's got dents and irregularities. And that's because, in my opinion, a couple of things were done. Liposuction occurred at a level that was too close to the skin. And you removed too much fat and you created a reaction that caused the skin to retract down and stick directly or nearly directly to the muscle layer. There's not much intervening fat. We all need intervening fat to kind of give us smooth contours and gliding surfaces so that we can move easily. This was too aggressive, probably with a cannula. And the cannula is like a metal straw that we put underneath the skin through a small incision to help, that has holes in it to kind of help remove the fat. When you're suctioning close to the skin, you want to be really, really, really careful, of course. But you certainly want to use a really thin cannula with maybe one opening so that you can remove fat very, very gently and, judiciously or thoughtfully. You don't want to use a big cannula that has multiple holes that removes fat aggressively. And I think probably that's what happened here. Big cannula close to the skin, lots of holes in the cannula to remove fat aggressively, and you get all these irregularities. So bad, 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 bad. The second thing is maybe the liposuction went fine. It was done deeper, closer to the muscle layer where you can use the bigger cannula as you kind of come closer to the surface of the skin to contour. You use thinner cannula. But then they say, the doc's like, I'm going to add energy to this. I'm going to really shrink the skin down. And they added too much energy in certain places. So again, I'm not a big energy guy. I will use it here and there where I think it helps. If you got loose skin that you're trying to add energy to, then you probably need some type of tummy tuck. We just got to get down to it. You know, it liposuction plus energy is going to improve it, but it's never going to make it what a tummy tuck can be. So in this case, maybe she needed a different type of tummy tuck. There's a certain tummy tuck that you can perform almost like an umbilical float, but keeping the umbilicus or the belly button still stuck down. I mean, I know I'm getting a little technical here, but you can liposuction her because she looks fairly thin. And maybe she's got a little bit of excess skin kind of down just above the pubic area. Maybe you get down there and you remove that excess skin. You kind of get underneath that skin and up toward the belly button, free it up and pull that skin down and remove more. And she has a nice contour for liposuction. We don't disturb her belly button. We've taken the excess skin as much as we can that's below the belly button down, and that'll work for her. So, again, certainly that is an option, but in general, if doc has to add a lot of energy to kind of shrink skin back after liposuction, you're probably a candidate for tummy tuck, and that's the operation you should have. On that note, let's look at the next problem with liposuction. It's just bad contour. Again, she still has different patient, still has some bulges kind of to our left down in her uh, left quadrant, just below her belly button, down on her right as well, and then above her belly button. Again, just not really executed very well at all. She's sticking out her hip a little bit too, but I do think she has her some fullness on her left hip as well. So again, not really executed expertly, in this particular scenario, I think just repeat liposuction for her to kind of improve her contour. And with this young lady, she doesn't really have a lot of excess skin. It's mostly at the top or above her belly button. We have a conversation. I will have a conversation with her. Yes, we can make this better with liposuction. We cannot make it tight, like or more sculpted as if we were going to do a tummy tuck. And you're not a candidate for a tummy tuck because you don't have enough excess skin. So liposuction is going to be your best friend here with modest results at best. And everybody's got to accept that or accept no surgery at all in my practice or in my hands. So again, poorly executed in my opinion can be corrected with properly executed liposuction with the understanding from the client that this is not going to be perfect but better. So that's liposuction. So let's continue on with the abdomen, and we're going to jump over to tummy tuck. Everybody, most people, I say everybody, most people are afraid of a tummy tuck. The- when I talk to clients, they really get all unraveled about the scar because I think they have perceptions. Of course, they don't know what is going on underneath, and nor should they know. That's why they're having a conversation with me and I'm educating them. But they have all kinds of preconceived notions that they're literally being cut in half. You're not being cut in half. This is skin deep down to the next most robust layer, which is the muscle. And we're not cutting through the muscle. We're not then cutting through your organs, and we're not getting to your spine. We're not doing any of that. It's just a longer incision that is below the skin and above the muscle. Sometimes the incision is long. You have to have it long. If you have excess tissue above your belly button, down below your belly button, out toward your hips, you got to make that incision so that the work can be done that needs to be done so that you can get the results you want. Everybody wants an incision this big. Heck, I want an incision that big because it's less sewing for me. But that incision is not going to do anything for 99% of the patients. It is just what it is. So, having said that, the incision is important. The incision placement is important. Let me pull this up. I think I got it. Did I pull it up? I talk about that. Did I pull it up? Let me just give me 1 second here. I'm gonna have to go to my screen. I did not pull up that picture. Shame on me. All right, so we're gonna do this. Pull it up, and here we go. All right, perfect. All right, here we go. All right, there are a couple things obviously wrong with this. This was done by somebody who wasn't a plastic surgeon. I'm gonna paint a scenario. You go to your gynecologist. You're having lady problems, so you need to have a hysterectomy. And you're talking to your gynecologist, and you're going, I'm glad I'm getting this done. I've had heavy bleeding. I've had fibroids. I want to get this squared away, but I really would love to get this excess, tissue, excess fat and skin taken off from my babies. I mean, can you just do that? We're already there. It'll be under anesthesia, under insurance. No, no big deal, right? Wrong. Big deal. Because you'll have some OBGYNs who will actually do this, and they have no concept of how to do an abdominoplasty. They'll simply do their hysterectomy, which they are experts in, and then they'll just take off the excess tissue and stitch it up and call it a day. Some may even try to lift up the skin, try to do something with the belly button, and who knows, maybe tighten the muscles, like in this case, and close this up. This is terrible. This is terrible. The incision is way too high. Way too high. The incision needs to be below her bikini or panty line that she has here. It should be right in the middle of that panty line. That's where it should be. And you should be able to lift that up, take care of the muscle, take care of the excess skin, take care of the belly button. Look at that belly button. It's kind of off center. It's got kind of keloid type healing, and it's small. Again, probably because it was stripped of its circulation during the surgery by someone who doesn't understand the surgery. This is why plastic surgeons do that. We understand the circulation to the skin to keep it alive in every part of the body. So you don't skinny down the belly button from underneath and then hope that it'll heal well. And you got to place the incision aesthetically. So how would somebody treat this? Well, I'm not going to tell you about that because you're going to have to wait to the end of the episode, which we're rapidly approaching, and I'll show you an example again of a case that I like to use because I think it's super super interesting. But this is correctable, but this is more than a notion. This is more than a notion, and I'll leave it at that. Last but not least, we're going to talk about BBL really quickly. All right. Obviously, I don't need to say anything. This is jacked up. So, obviously, her contour is terrible. She's got unequal volumes in each cheek. She's got some type of lump, which is probably representative of an old seroma, which is a collection of fluid that wasn't treated properly. Now it's scarred in. And it looks like it probably was done by someone who doesn't really get it. And what I really mean by that, look at the little dots on the side of her butt and hip area on the left-hand side of the screen. She's got three little dots there. That's probably where they entered. That's not an aesthetic way to place fat or to introduce the fat. I typically will introduce the fat in the upper butt crease. If you go to the right-hand side of the screen, just right at the upper butt crease, we can introduce fat. That's an area that's unseen. I introduce it at the lower crease down below. That's not readily seen. Occasionally, if out of great duress and need to do something in the outer buttocks or thigh, I will place one on the thigh. That's just what it is. I have to do that from time to time to get the contour needed, but I really try to use really inconspicuous areas. This is so obvious that either she has some type of skin condition or she had a surgeon who just willy nilly just put incision points wherever he or she could get fat. And then it didn't do a great job on top of that. So now she's got this plus these little pock marks, for lack of a better term. So, how, is this correctable? Yes, this is incorrect. This is correctable. You got two things. She doesn't really have a lot of fat. If this is abnormal fat, I would try to just contour the fat, remove it. It's not the greatest solution in the areas that is full or the contours are not normal in hopes that that skin will retract. It's no guarantee. She could end up with a saggy backside. So I would try that. And that probably would be the best thing to do is to just try to remove fat to even things out and then reevaluate from there. If she really, really, really wanted more buttocks volume and really wanted to proceed on with another surgery, I mean, I guess buttocks implants would be the next thing to next operation to go to. I don't particularly do buttocks implants, but I think they're really difficult and need to be done by someone who does them basically all day, every day. And there are guys and girls in the country who do that really, really, really well all day, every day. But for her, I think we would just liposuction the areas of fullness to kind of even out her contour, and then try to call it a day. We're going to make this better, but not perfect. So for you clients who are looking for BBL, you want to make sure that you talk to your surgeon again about experience, incision and placement, how to handle complications like fluid collections or infections, so that you feel that you're in the best hands possible to avoid problems on the front end by identifying concerns and kind of making plans for them, avoid problems in surgery because basically you understand this physician's or the plastic surgeon's experience, and then someone who's going to be with you all the way to you recover to take care of any problems that may pop up. So you want to make sure you do your due diligence. So last but not least, let's bring up one of my personal cases. Again, it's a favorite of mine, and I think it illustrates most of the things that we talked about today. So let me pull this down, and we're going to bring this up. So again, a lot of you may have seen this case. This is a hideous case. This is a young lady who went to a gynecologist, and she wanted liposuction of her tummy and fat grafting to her hips and buttocks. Lo and behold, he did that in, I'm assuming, his office, uh, and she ended up with flesh-eating bacteria. She ended up in the ICU in one of the hospitals in Atlanta near death. She was thankfully uh, treated by one of my dear friends and saved her life. But he had to take off a bunch of dead skin that was really wreaking havoc to save her life. And so, when he did, he took off a bunch of dead skin from her abdomen because of the flesh-eating bacteria, and it resulted in this terrible scar. Now, is the scar the botched surgery? No, the scar is not the botched surgery. The botched surgery is, from the gynecologist who's not nearly trained at all to do any of those procedures, uh, who could not recognize the patient was sick or septic, which means that they have such a bad infection that they may die, and resulted in flesh-eating bacteria. That was the botched portion of his operation. The resultant portion of her salvage or saving her life is this scar. And she's young, she's in her 20s. How do we fix this? It's much like, in a sense, the scar that we had from the tummy tuck procedure I showed you that was too high. We've got a scar that's wide, too high. I don't even know there is a belly button. And she presents to me. So how am I going to fix this? How am I going to get rid of this so that she feels remotely comfortable and not emotionally destroyed? So what I decided to do is to use my training in plastic and reconstructive surgery. And this is where it's different than your cosmetic surgeon because I know how to do cosmetic surgery, aesthetic surgery, also know how to do reconstructive surgery. I've worked on many people's abdomen to help my colleagues in general surgery, spine surgery if they do an anterior approach to fusing a spine, many times to help restore contour. So what I decided to use for my reconstructive experience is to place balloons in the skin above the scar. I just took her to the operating room, put her to sleep completely. We made an incision in that hideous scar because it doesn't matter, it's going to come out. I snuck balloons underneath the skin, three of them above. And then in the office, over a period of a couple of months, I filled those up with salt water and stretched her skin like she was pregnant. And so now I've got a pregnant, quote, pregnant type of belly. And what I want to do is go in after I've stretched that as far as I can, as far as the skin can stand, as far as she can stand, so that I can take her back a second time to the operating room. Remove those balloons and take that excess skin and try to find my belly button, take out that hideous scar, and pull that skin down, much like a tummy tuck. And that's exactly what we did. And I was able to find her belly button. And after doing that and allow that to heal for months, this is about a 6 month to a year result. She had the area tattooed. The scar was pretty decent. Wasn't bad. Definitely better than that. About a million times better than that. But she wanted to tattoo it. So this is her final result. The scar is within her panty line. You can't see that. She's got a tattoo there, but it's in her panty line. And her belly button looks fairly natural, where she didn't have a belly button that we could tell at all. So again, you want to try to avoid this. You want to try to avoid having a problem like this by one, going to a plastic and reconstructive surgeon, such as myself. You want to make sure that these folks, such as myself, are certified by the American Board of Plastic Surgery. It is important. I want you guys to take a snapshot, write it down, save it. If you're thinking about having plastic surgery, you need to go here first. From you have a doctor you like, a doctor you've been following on social. See if he or she is here first. If they're board certified and they're active, that's check one. That doesn't mean that you won't have any complications, but if you do, you're in better hands than going to a gynecologist and having a problem where they almost kill you. You want to make sure that you do that. So, with that being said, I think I've said all I can say about, botched or beauty. It's important that you guys, as clients, know what to look for. Again, I've left this on here. Start here with a plastic surgeon that you like. You like his or her work. You've been following him. I would love for you to work with me. I mean, but I'm certified by the American Board. You want to make sure whomever you choose is certified by the American Board of Plastic Surgery. I think certainly you that plastic surgeon can also be part of the American Society of Plastic Surgeons, but I'm also a member of the Aesthetic Society because I focus on aesthetic surgery. So you should be able to find that plastic surgeon if they've been in practice long enough because you can't just join right out of training. You have to have built up a portfolio of work, a portfolio of experience to join this exclusive society. Uh, look them up and see if they're a part of the Aesthetic Society. I'm a part of that society. I take great pride in being a part of that society. It really helps me continue to sharpen my experience and skill set. So, beware. That's your first step. That is your first step. And again, I've given you some pearls here and there, but if you don't remember anything, just go to the American Board of Plastic Surgery, start there, maybe jump over to the Aesthetic Society to kind of, you know, build on your confidence that the person that you're looking at as far as being your plastic surgeon has the training, has the experience to get you to a successful outcome without any problems or a successful outcome despite problems. That's what you want. So again, it's been my pleasure to spend Saturday morning with you. I hope you have enjoyed. This was live. I didn't get any questions. I saw some people watching. It's okay. You can kind of alert if you have questions. Again, you can drop them in the comments down below. I'll check back and I'll try to answer them. You can call my office and schedule an appointment. The number is there. I would love to sit down and chat with you for an hour, hour and a half, so that we can really get you the information so that you can make the best decision for you. Because that's what it's about at the end of the day. It may be surgery, it may not be surgery. It may be surgery with me, it may not be surgery with me. But you want to make sure you have all the information, and you'll get it here in my practice at ESJ Aesthetics here in Atlanta, Georgia. So, on that note, I really appreciate everybody coming out, joining, watching. Please, please, please like, subscribe, and share. On that note, everybody have a wonderful Saturday. Peace. I'll see you next Saturday. Thank you.